Let me get up here. Um, all right, can you see my screen okay?
Mm-hmm.
Okay. All right, well, my name is Kayla Peterson. I am the recruiter here with Mille Health System. I've been working here for a few months now. A little bit about me. I started out in the healthcare field when I was 16. I started out as a direct support professional with a group home service down in Blaine, Minnesota. Obtained my CNA certificate through a nursing facility who paid for me to get that. From there, I then worked in scheduling. I worked in the physical therapy department as a rehab aide for a while, and now, after finishing my bachelor's degree, I now work in HR at the hospital. There's many different places you can work and different things you can do in healthcare, as we're about to talk about today. So don't feel like you're stuck in one role forever. There's definitely a lot of opportunity for change there. So a little bit about my facility here. Mille Health Systems, this image here is a photo of our new building that is opening up later. Well, we're supposed to open the end of this month, early next month, but everything continues to be on hold from there. As of right now, we're set to go for next Tuesday, so we'll see how it goes. A little bit about Mille Health System. We began in 1956. We our critical access hospital, and then from there we added on a nursing home and an assisted living facility. We also have a geriatric mental health unit. We like I mentioned, we're growing, so our new addition will have a brand new hospital setting for inpatient care. We also will have a new emergency room, a new urgent care department, and a new admissions department. We are community owned, and we're also a nonprofit, so we take the opinions of those within the community on how our services are provided very seriously and implement those every day in what we do, and take that information and see what we can do better. We have also some other services. We've got infusion therapy in our same-day surgery center. We've got physical therapy, occupational therapy, and speech therapy. We also offer home care and hospice services to those in the community around us. That type of service is where nurses and home health aides and CNAs will go into patient homes and provide them with cares, assisting them with bathing, that kind of thing, or doing some work around the house, things that they may not be able to do. We also have 5 outlying clinics. We've got a clinic in Garrison, Hillman, Malacca, Isle, and then our main location here in Onamia. So today we're just going to take a little bit of time and talk about the 7 compelling reasons to work in the healthcare industry. Let's see here. So there are many opportunities to work in healthcare. Of our 480, about 480, it's a little bit lower right now with the staffing crisis going on, but of those employees that we have, only 21 of those employees are actual physicians or a physician assistant. And then the rest, we've got another 50 of them that are registered nurses, and that's still not even a total 100. So the remaining employees are caregivers, their housekeeping, their maintenance, their us here in administration, just many different departments you could go in. Based on the other industries, healthcare offers better salaries and better benefits. Even at an entry-level position here at Mille Health System, our lowest paid starts at about 15 to 16 per hour. And if you were willing to go and obtain a 3 or 4 month certification, you can easily increase your earnings to $18 to $20 per hour. The increases obviously would go up from there with the more education and more experience you obtain. So there is a lot of flexibility in the healthcare field with what you can do and what type of work you can do. Not every employee has the opportunity to work 30 hours a week and be considered full-time. Here at our facility, we have full-time equivalent positions, which means that if you're working that 30 hours, you're still considered full-time and you would get full-time benefits, even though you're not working a full 40-hour work week. And then, so we are a 24-hour, 365-day-a-year facility, which means that there are many different shifts that people can be working. You have the ability to work anywhere, and those careers are rewarding and fulfilling. Some of the best people you'll ever meet are those that work in healthcare because they're compassionate, empathetic, and just, really relatable and care for those that they're taking care of and enjoy what they do. See here. So there's just a variety of positions that we have here. This is just a short list of the many that, we have. Um, there's a variety of educational opportunities you can obtain to get these positions, like an entry level position, and then you could quickly work your way up the scale. In nutritional services, that's like our food service workers, dietary. We've got those that deliver the foods to our patients and our residents in our long-term care and the mental health unit. They also help prepare the food and take care of, the cleanup and the prep work all in the kitchen. We are actually opening a new cafeteria this end of this week in our new building. So that has been a fun challenge for the nutrition services department right now, trying to figure out where all their tools are in the new facility. We also have environmental services. That's our housekeeping department. They are the ones that keep the facility clean. We have many different roles down there. We've got linen aides. They're the one who make sure that, our patients have fresh bed sheets and towels, and, the cafeteria has enough napkins and stuff like that. There's floor aides who help ensure that they're keeping the facility clean, that everyone, there's no trip hazards, or with the snow that the floors are staying dry and people aren't slipping on the wet floors. And then we just have our general housekeepers who do, like bathroom cleaning, garbage disposal, that kind of stuff. We've got the maintenance department. They provide all of the maintenance for our facility. So if, your door's not closing correctly, they'll come and fix the lock there, stuff like that. And then we've got the admissions department. Those are our patient access specialists. Those individuals register people and deal with insurance companies, making sure that you're able to be seen and our facility is in your network. They also do new appointment scheduling. In the patient accounts department, they handle all the detailed billing through the patient's insurance. So if you come see us, and then they will verify that your insurance is in our network, and that you're not going to be sent a huge bill because you went to an out-of-network provider. Health information is a big department here as well, along with us here in human resources and administration. We here in human resources, we ensure that our employees are happy with their work and enjoy doing what they're doing. And then health information, they're just the ones who are managing all of the patient information, making sure that we have everything up to date, and just that the systems are operating as they should. Our next department is IT. They are a crucial part of how we operate and how we function. Without them, we wouldn't know if our computers would function properly, or if our systems are even up to date with safety precautions to house our patient information. Being a large healthcare facility, we're always at risk for, cyber attacks and such. So they play a crucial part in keeping our facility safe in that aspect. We also have the finance department and the materials department. Finance, just make sure that all the bills are paid and the lights stay on at the facility. Materials ensures that, all of our products are up to date. So if we needed, new signs or anything like that, they'll make sure that we have all of those available. Quality is another department that's not really talked about much. They're the ones who take the patient surveys. So once you come see a provider here, usually they generate a patient survey, and just ask you how we're doing as a facility, what we could improve upon, kind of go through that. And then they also do the tracking. So they make sure that our providers are meeting, their standards and have the correct information to provide you the most quality care. And if there's ever a complaint, they're the ones who handle that as well. They, generate all that and then take the steps to implement the systems to make sure that we're making those improvements where possible. Um, and then the last one is our EMS service. They are like the EMTs and the paramedics and the emergency medical responders. So those are like the drivers for the ambulance. They are like the most frontline workers that we've got. They're the ones going out into patient homes, showing up on the scene of accidents first in line. So yeah, a little bit about some of the opportunities, and that's just touching just a little bit of the surface of what's available here. Um, so next, we're going to talk a little bit about salaries and how those impact, making a decision on what type of field you might want to work in. Having an impressive salary won't do much good if you can't find a job in that field. The outlook for the healthcare field is great. From now through 2029, the projections are about a 15% increase. And you can see some of those jobs listed are like laboratory technologists, they have a 14% growth. Medical assistants, they have a 23% rate of growth. Physical therapy assistants and aides, that is not usually like that long of a program, and a physical therapist aide actually does not even require a certification. It's more so like scheduling and rehabilitation information like that, kind of matching what provider would be able to provide that service to you. That department is expected to have a 40% rate of growth. And then radiology techs, those are the ones who go in and do the x-rays, CTs, help with procedures and such. They have a 9% rate of growth. And surgical technologists have a 15% rate of growth. That's just some of the jobs we have available here. I believe right now we have a job open in every single one of those departments. So if that's ever an interest to you, feel free to ask any questions about that. And even now, like if you don't have a degree in those positions, we have a lot of availability for opportunity for those under the age of 18 or those that don't have much work experience as well. You can even start working in our dietary department in the kitchen as soon as 16. You can also be a CNA at the age of 16 as well. And then once you reach the age of 18, there are some entry-level positions that don't really require a degree, but maybe like a further certification. You could be a patient access specialist. Usually they just like you to have, like a nursing assistant certification or something along those lines where, you just have a little bit more experience, but nothing too crazy. They don't require a 4-year for that one role. Let's see here. Those patient access people, as we had talked about before, they're the ones who do the registration. They just schedule appointments. They work with your insurance. You could also work as a maintenance worker without needing a certification or a degree, or a pharmacy technician is one that does require a certification, but I believe it's only like a month-long course. And then you just maintain that certification with your continuing education, which we would provide. Let's see. And those pharmacy technician positions, they're a little interesting. They're kind of like an assistant to the pharmacist. So they help prepare the medications, and then the pharmacist would go in and confirm that they're all correct and everything is set up and good to go. But like I said, that certification process is not very long. An EMT is another position that we kind of touch base on. They can actually start work after they complete 120 hours of training, and then you have to take a test that is run by the state. We have a lot of physicians here who actually started out as EMTs in our field, and they worked as an EMT all the way through medical school. We also have those emergency medical responders. Those are the drivers of the ambulance, as I had mentioned. For that role, you do have to be 21 and complete the EMR certification course offered through the state of Minnesota as well. We also have some home health aides that work alongside the nurses in the home care and hospice department. Like I had mentioned, those individuals are the ones who go into patient homes and provide care and additional assistance with like vacuuming or dishes, that kind of thing. We also have what's called a HUC. They are the healthcare coordinator. Those individuals are responsible for keeping everything in order on the unit. They do patient registration. When they come into the hospital, so they're the ones who get them set up, make sure that everything is ready for the doctor. They make sure everything in the chart is up to date. They greet people, and they do inventory and maintain the patient records as well. And then another profession that you can look into is a medical coder. Coders are responsible for reviewing and assigning medical codes for proper reimbursement, that kind of thing. Like they'll reach out to the doctor if they're not sure how the procedure was done to match to the appropriate billing number. And then that number is what's sent to your insurance and determines how much they're willing to cover. They also have phlebotomists. They are the ones who do the blood work. So you go into a patient's room, draw however many vials of blood they need, and then get it sent down to the lab. That one is actually a certification or a trainable position. So if you're kind of interested in it but don't have the certification quite yet, our lab manager does do on-the-job training for that as well. And then we have a surgery technician position. That one is a certificate-based position as well. They help with the surgery sterilization process and anything really going on in the operating room. So if they need additional tools or anything, that's the individual who would grab those. And like I said, those are just some examples of the jobs that we have available without a degree. There are many different types of opportunities here. Even if you were to get your two-year degree, obviously, we would match you with a position that matches your current education level, hoping there's something available and something that piques your interest. And then you could go on to finish your four-year degree and, go get a different job here with us in the Excel system, or take your experience and go elsewhere. Obviously, we wouldn't want you to do that, but we would, love to see the growth from within. Right now, we have openings in our long-term care for nursing assistants. With COVID, we are also offering a position called a basic care aide. That position is a 9-hour online course that you complete, which usually doesn't take 9 hours, but it's 9 credited hours in the state of Minnesota. You take it on your own time, and then after you complete it, you're able to come in and meet with an RN. Once you get that completed and the nurse signs off that you're able to provide, the basic cares of that position, you're able to work under nurse supervision in both the long-term care department or the geriatric psych unit. Right now, that position is correlating with the COVID guidelines. In time, that position will go away, and that's where you would have to get your nursing assistant certificate. But we also do those courses on site, as I had mentioned. So you can be the age of 16, come in, work as a nursing assistant, and then you just wouldn't be able to operate the lift equipment is the only restriction there. And then next month, we're actually starting our nursing assistant course here on our Onamia campus. We have one in-house that our director of nursing is running, and then we're also having Pine Tech come out, and they're doing their own course as well. Both of those courses are free. If you would like some further information on that, feel free to call. I did include my contact information at the end of this PowerPoint. And we also have, openings in dietary and stuff like that. So whatever is an interest to you. And next, a little bit of information is just some of the benefits you have while working here with us. We have discounts at the pharmacy for our employees. So if you needed your prescriptions filled, you could send them to our pharmacy here. They are a lot cheaper than elsewhere. We also have over-the-counter medications available all day as well. Those we have, like Tylenol you can get a big bottle for like the 98 count or the 100 count for about $1.50. It's really a good deal what they have going on down there. We also offer health insurance coverage for individual and family plans at reasonable prices. I believe the single coverage plan starts at about $120 a month, which is really a good deal compared to what you're finding a lot of places right now. We also have, health savings accounts with that. So we contribute about $100 into that account for you every month, just to make sure that, you're getting support paying your bills. We also have long-term disability, short-term disability. If anything were to come up and happen, if you broke your arm and you weren't able to go to work, you would, want to utilize those services and, be able to get paid while doing that work. We also offer 403B and a Roth IRA retirement account. Since we're a nonprofit, it's not the same as a 401k. It is a little bit different, so that way you get a little bit more tax benefits with that. The 403B is taxed upon withdrawal at retirement age. So when you hit that point where you're starting to withdraw from your retirement account, that one is when you would pay taxes on it at that point. The Roth IRA is where you pay tax on it while you're putting it into your account. So it's a little bit different, but then you're not paying taxes on it, when you go to pull it out at retirement. We also offer a 4% match at 100% on both of those. So you could do 2% in a 403 and a 2% in a Roth IRA, and we would match both of those up to 100%. Another nice tool that we have is we also offer the 30% service discounts for our employees. So if you see a provider here, like in our clinic, you go see a doctor, something like that, we offer you a 30% service discount. If you're unable to pay your bill in full at the time of recipient, you don't have to actually pay it all. Like if you can't pay it all and you just want to avoid it, you can actually talk with our billing department. They'll not only give you that discount, but they'll also work with you to set up a payment plan, which are interest free, and then they will actually take it out of your paycheck if you would like them to. So you don't even have to worry about getting that sent over to them. And then another nice added benefit for you guys would be a tuition reimbursement. It's a really nice program that all employees qualify for after they've completed 1 year of service with us. And so for that 1 year, you have to be at least a 0.5 FTE. An FTE is a full-time equivalent. If you were at that 0.5, it means that you would work 20 hours a week in a 2-week pay period. So 40 hours total. If you were to work that 0.7, where they would match up to 80% of your tuition reimbursement up to that 3,000, that 0.7 would mean that you work 56 hours in a 2-week pay period. And, if you're going for some degree or for a certification, you can get reimbursed for both of those. Actually, I'm using the tuition reimbursement program myself for my human resource certification. So you can get reimbursed for, not only the courses that you're taking, but the books, the materials, everything like that. We also have a lot of student loan forgiveness programs, which aren't mentioned on this slide. For nurses, since we work as a nonprofit facility, there are a couple different options that you can use to have your student loans forgiven, and even in administration. So if you were ever interested in going to an administrative role like us here in HR, working for a nonprofit, you actually qualify for that public student loan forgiveness program run by the federal government. And you would be able to have your student loan balance forgiven after 10 years of qualifying payments. So it's really nice. Lots of different tools so that way you're not stuck paying all of your student loans back. And then I think that is all I had. Does anyone have any questions for me at this time?